The coronavirus has ravaged the world for more than 6 months now, and countries have had to make adjustments with restrictions and movements as a result of the virus. This has gone on in anticipation of scientists bringing an end to the virus with a vaccine so that life can get back to normal. Nobody knows or is saying when this will be. That's when the end of the virus will be. There have been attempts at creating vaccines and herbal treatments that, according to the World Health Organization, have not been successful. And right now, scientists say the COVID-19 pandemic will continue to rage on like a forest fire as some countries are experiencing their second wave of infections and others are imposing another round of lockdown. Will the predictions of epidemiologists and virologists that infections will slow down during the summer come to be? This and more, many more, we'll find out in the course of the program. The statistics for today shows the global cases at 19.1 million and the deaths at over 700,000, while the recoveries are over 11.5 million. The NCDC in Nigeria puts the figure of infections at 45,244. The deaths are inching towards 1,000 as the figure is now 930. The recoveries are 32,430. Now, the number of COVID-19 cases on the African continent has surpassed 1 million, with South Africa being the worst affected. Information coming from the CDC indicates that there have been a little over 22,000 deaths. The course of the pandemic, however, has been much less than predicted by the World Health Organization that warned in May that the virus could cause as many as 10 million infections on the continent within 6 months. This is COVID-19 Myths and Facts. Welcome on board. When the coronavirus first emerged, most people called it coronavirus. But as the situation got more serious, experts began to call it novel coronavirus and then COVID-19. Why did the name seem to change? Here are some details to this.
According to scientists, COVID-19 and coronavirus are actually two different things. One is the name of the disease and the other is the name of the virus. COVID-19 is a strain of coronavirus that was first found in humans in 2019. To be specific, COVID-19, which stands for Coronavirus 2019, is the name of the disease caused by SARS-CoV-2 virus. The virus itself is named SARS-CoV-2. Each part of the name is an abbreviation. SARS stands for Severe Acute Respiratory Syndrome. CoV stands for coronavirus. 2 represents the second strain of this type of coronavirus to show up after the first appeared in 2003 and caused the SARS epidemic. Using this type helps scientists group viruses into families that have similar characteristics. For instance, all coronaviruses display a distinctive crown-like appearance under the microscope. Grouping viruses into families allows researchers to quickly compare new viruses to existing ones in the same family. Because the earliest confirmed cases of COVID occurred in late 2019, scientists added the number 19 to the end of the name to make it more specific. If another new kind of coronavirus emerges and causes a new type of coronavirus disease, it will be named for the year it was first identified.
And scientists say the COVID-19 pandemic will continue to rage on like a forest fire. Epidemiologists and virologists who study infectious diseases predicted that the coronavirus might fade in the summer and return with a second wave in the fall. But they haven't seen it slow down.
Wave theory was based on what happened during the 1918 flu and the 2009 H1N1 flu pandemics. 2 other scenarios said that the first wave of the coronavirus could be followed by a cycle of smaller waves, or that there could be a slow burn of ongoing cases. But none of the scenarios have played out as previously predicted. Instead, this pandemic has seen a surge in cases in different cities at different times.
There is no silver bullet at the moment, and there might never be. For now, stopping outbreaks comes down to the basics of public health and disease control.
Meanwhile, some scientists believe the world could get past the pandemic that has claimed more than 700,000 lives worldwide by the end of next year with the help of a vaccine. A top U.S. infectious disease official, Dr. Anthony Fauci, says drug makers will likely have tens of millions of doses of coronavirus vaccines in 2021.
Historically, if you get a vaccine that has a moderate to high degree of efficacy, and you combined with that prudent public health measures, we could put this behind us. It's very difficult to get a cohesive message when you have some people who do well and don't even get symptoms, and some people who die from this. So unless everybody is on the same wavelength and saying, we're all going to do this the same way, we're all in this together.
According to the World Health Organization, the best thing is to follow the safety guidelines to slow the spread of the coronavirus.
So joining me now to examine some concerns raised is Dr. Yahaya Desu. He is the head of risk communications at the NCDC. Thank you so much for joining in, Doc. Now, the World Health Organization has said it, no silver bullet for the health crisis. What do you make of the various efforts, by a whole lot of organizations to curb the spread of the virus as we race towards the vaccine? Doctor, so the World Health Organization has said there is no silver bullet for this, for the crisis. What do you make of the various efforts by different people to curb spreading the virus as we race towards a vaccine? So we seem to be having a challenge there. And what we're talking about is activities being done by different organizations across the world as the world races towards a vaccine. Can we prevent a second wave? Can we prevent it happening again? We already know that a couple of some places in the world have already imposed another lockdown. I'm talking about Victoria now in Australia. Yes, in Australia, they've already imposed a second lockdown. And before then, people had gone out shopping to stock up their homes and all of that. And other countries as well, facing a second wave. Would there be a third wave? Africa, for instance, has not had it as bad as other countries. Could it be the weather? We're not sure. Now, the coronavirus is such that people are trying to understand as it unfolds on a daily basis. And that's what we try to do here, right here on the COVID-19 Myths and Facts, to unravel the facts and the myths surrounding the coronavirus. We did tell you earlier on about the figures in Africa that are quite lower than what is happening across the world. Don't forget, right here in Nigeria, we are used to taking. Okay, so let's get back to my guest right now, who is back on standby, Dr. Yahaya Desu from the NCDC. Thank you for joining in. So according to the World Health Organization, there is no silver bullet to end this crisis. What do you make of the various efforts to curb the spread of the virus as we race towards a vaccine?
Okay, thank you very much for this. The first thing is this is a novel outbreak. And we're still learning so much about the disease. And then one good thing is we now understand to a large extent how it is transmitted and how it can be prevented through public health measures. And then again, we still have a large number of people who are asymptomatic about this disease. Then they carry the virus, they can spread it, but they don't show symptoms. And then why are they asymptomatic? And so we need to understand a lot of factors why some people don't show symptoms. And why is it that some people are so vulnerable? Although we know that people who have comorbidities are more vulnerable. At the same time, people who are quite old, greater than 50 years of age. But various efforts, based on the little understanding we have, include public health response, like testing, knowing those who have it, and then tracing contacts of those confirmed cases and isolating them for intervention to take care of them in case they come down with complications. And then those ones have helped. But also, because we understand that a large number of people are asymptomatic, they spread this. That's where non-pharmaceutical interventions have also been recommended, which includes use of face masks, physical distancing, regular hand hygiene, and as well avoiding mass gathering. Then also at some point, a lockdown was implemented. Early studies have shown that without a lockdown, without control, the basic reproduction rate, that is the average number of persons infected by one person, was about 3.8, so just about 4. But with control, with those lockdown, in a place or countries where they are effective, it comes down to about 0.5. And this determines the degree to which we can control this disease.
Okay, let me just...
vaccine coming on board.
Okay, let me just...
vaccine coming on board.
Okay, talk about the vaccine.
You know, we have not seen the vaccine. The efficacy of the vaccine, we don't know yet. And then we don't know how many doses you have to take to be fully immunized, and how long will this last in the body. Those are factors that we need to understand. Even the safety of the vaccine is an issue. So clinical trials may take a while for us to understand all these, and then before we can now say vaccines can be used. But for a good reason now, we have to rely mainly on the public health interventions and non-pharmaceutical response to this.
Okay, you talked about the new lifestyle. How long do you think we can sustain this? And by that I mean the social distancing, the lockdowns, because people really got tired of being locked up in one place. Face masks, sanitizing. Yes, people are used to it to some extent now. How much longer do you think this can be sustained?
It's likely behavioral. And then behavioral change takes time. But it's also based on our understanding. If all of us agree to use face mask at the same time, observe those measures, you will find out that we will just break down this transmission immediately. But because a large number of people don't believe this, some people feel, after all, they are not that vulnerable, but they have forgotten that they can spread it to their loved ones. If we all have understanding that this thing can come into our homes and consume the vulnerable ones, the vulnerable ones who are our loved ones, and then we all agree to face this at the same time, I believe that we can break this transmission.
All right,
but
thank you.
It depends largely to the cooperation, understanding of the people.
Thank you so much for your thoughts. Thank you for your time. We have to go now because we're pressed for your time. Thank you so much for your time.
You're welcome.
All right then. And that's our package for today, the COVID-19 Myths and Facts. Thank you so much for watching. Remember, whatever you do, stay informed and stay safe. Bye for now.